Hello, everyone. A very good afternoon to all of you. I'm Sayunkta from Radiance with You YouTube channel, and I'm sure all of you must be keeping in good health. Now, today we are talking about something that affects everyone, no matter where you live, and that is fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when we think of our health, but they are important and can cause serious problems if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem, we are also here to talk about what we can do about it. We'll look at how to stop fungal infections from happening and talk about the latest treatments. This month is also about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert, Dr. Bhushan Chaudhari, who is MBBS DVD and is joining us from Jalgaon, consultant dermatologist, Dr. Bhushan Chaudhary. A very warm welcome to you, sir.
Thank you. Hello.
Yes, doctor. Doctor, as today we are going to talk about fungal infection, what are the most prevalent fungal infections in our region and what prevention strategies do you recommend for us?
See, the fungal infection is a very much rising concern nowadays, because as we live in a tropical climates, the hot and humid climates basically give
Right.
rise to fungal infections. So uh, uh, nowadays people are we are in the tropical climates and we are living in a hot and humid climates. Fungal infection is rising. Due to this, we are facing many challenges. So, how can we treat the fungal infection? We can treat by fungal infections by wearing a loose clothes, maintaining a proper hygiene, and take a medical help whenever necessary from dermatologist.
Right. So it's very important first to take these preventive measures. और हमेशा कहते भी हैं स्पेशली मेडिकल फील्ड में प्रिवेंशन इज ऑलवेज बेटर देन क्योर. तो ये जो प्रिवेंटिव टिप्स आपने बताए दे गो अ लॉन्ग वे डॉक्टर इन प्रिवेंटिंग फंगल इन्फेक्शन, राइट?
Yes.
Okay. Now, doctor, another very important thing that you mentioned is that go and seek doctor's help as early as possible. But a very practical aspect tendency prevailing in our society is that rather than going to the doctor, we often go for home remedies, DIYs, or going for topical applications from a chemist shop, over the counter medication or topical application. How harmful can these topical application or DIYs, home remedies, etc., in case of fungal infection?
See, as I'm talking about my example, I live in a tier 3 city. So basically, people in tier 3 city, instead of seeking help from doctors, they treat themselves. So basically, they buy creams from shops, and nowadays mixed combinations are available in the shops in large amounts. So over-the-counter medication, these medications containing the steroids along with antifungals. So this I strongly condemn this combinations. Basically, you should not use that combination because by using steroidal combinations, you are already nurturing the fungus. So we should avoid that combinations, over the counter combinations. And of course, there are a lot of antifungal creams are available, such as doliconazoles, oxyconazoles, ketoconazoles. We can use that cream, but nowadays fungal is very resistant. By using only topical creams is not sufficient to treat the fungal infections. There are many oral drugs which needed in the treatment of fungal infections. So along with topical medications, we should use the oral medications, and it is also after prescribing by dermatologist only. So I should not recommend that people should use over the counter medications. Instead of that, they seek help from doctors. They should seek help from doctors.
Right. So over the counter medication, topical application are a big no no. Please, in case you have the signs and symptoms of fungal infection, go and seek advice from a dermatologist. A qualified dermatologist will help you. Now, doctor, you also mentioned that resistance is also becoming a big issue these days for our society. Another thing with fungal infection is recurrence. If somebody has fungal infection, there are chances that he or she will get it again. So, what is the reason behind it and how we can curb it?
See, the fungal infection, the pathogenesis of fungal infections is that the fungus lies in the stratum corneum, that is the uppermost layer of the skin, and it is a keratinophilic microorganisms. Keratin is a superficial skin protein, so it strives it strives and it feeds the fungus. So once fungus established in your skin, in your skin, it spreads through that keratinocytes, and uh, it is contagious disease. So by sharing the fomites, by sharing towels, combs, the fungus spread from person to person. So and again, the antifungal medications nowadays available, these are very mild medications. So you should use that medication for at least 4 to 8 weeks, otherwise the recurrence is there. So if you use that medication only for 2 to 3 weeks, the fungus will again recur. So to avoid the recurrence, people should use that antifungal medications, oral as well as topical, for a prescribed time only.
Hmm. Okay, right. So it's important to understand that in case you have fungal infection, you need to go and consult a doctor, qualified dermat, and then complete your treatment, complete the dose as well. Now, doctor, fungal infection is quite contagious. If one gets it, there are chances that it will get spread to people who are in, close contact. Now, in case there is a fungal infection, in one of the member of a family, what precautions the others should take that they don't catch it?
First of all, his once there is a fungal infection in the family, in one member, wash his clothes separately. Uh, Tell him to bath twice daily, and a separate soap is recommended for him, and always irons the clothes, because the fungal hyphae, that fungal spores, resides in the threads of a clothes. So that to kill that spores or fungal spores, one should iron the clothes daily, and separate washing is recommended. Separate washing of the clothes is recommended for that person.
Right. So personal hygiene and not sharing the infected one's clothes, bed sheets, etc., is equally important.
Yes.
Now, doctor, when a patient comes to you with the signs of fungal infection, or maybe the patient is not aware whether what is happening to him or her is fungal infection, for proper diagnosis, do you recommend some test or just by physical investigation, you're sure? Especially in case of people who have used topical application or steroid-based creams for a longer, time before they come and see you.
See, the diagnosis of fungal infection is mainly the clinical diagnosis. Uh, one can uh, One can diagnose the fungal infection only by seeing the patients. So we we live in a tier 3 city. So no separate test is required. But yes, KOH mounts as well as fungal culture can be done in complicated cases, or if the patient has applied steroidal creams already. So in the case of tinea incognito, we call it as a tinea incognito, because one cannot identify it as a proper fungal infections. But by applying the steroidal cream, the whole picture of the disease has altered.
Okay.
So to diagnose the complicated cases, we can use the KOH mounts, as well as fungal cultures can be done. But most of the cases, the diagnosis of fungal infection is a clinical only.
Okay. Now, doctor, what are the treatment options available for treating fungal infection, and normally how much time it takes to, heal the skin fungal infection?
See that there are various types of fungal infections depending upon the body locations. So
Hmm.
if the fungal infection is in the is over the scalp, we call it as a tinea capitis, which we commonly seen in children's, mainly in the boys. So tinea capitis, where according to locations, tinea capitis, which is a fungal infection of the scalp, tinea corporis, which is a fungal infections of the non-glabrous, that is non-hairy parts of the body. So depending upon the locations, as the sweaty areas, fungal infections grow more commonly in the sweaty areas. So the longer treatment is required in case of tinea cruris, that is the fungal infections of the groin, as compared to the other areas. So many oral and topical antifungal creams are available. We should take the treatment for at least 4 to 8 weeks. The total course is 4 to 8 weeks. To avoid the recurrence, always take the proper treatment and take it for the full course of full time.
Right. One should complete the dosage. Doctor, in case of
Yeah.
nail fungal infection, how does it looks like, and again, how much time it takes to get treated?
See, the nail fungal infection is very difficult to treat concept because the blood supply to the nail bed is very less. So the treatment span of the onychomycosis, we called as a fungal infection of a nail. The treatment span is almost 10 to 12 weeks. So almost 3 to 4 weeks are 3 to 4 months are required to treat the fungal infections of fingernails, and in case of toenails, another 2 to 3 months are required because the fungal infections is very difficult to treat in that areas.
What are the main reasons or causes behind nail fungal infection, doctor? Who all are prone or at risk of having nail fungal infection?
uh, Commonly the housewives, because they are very much in contact with water. So the nail fungal infection is very much common in those persons who are in continuous contact with water and detergents and soaps. So the candidal infections in the intertriginous areas or the nail fungal infections is very much common in the housewives.
Okay. Similarly, for scalp fungal infection, doctor, as you said, mostly infants or a proper hygiene of scalp is equally important for preventing scalp related fungal infection. A very common thing that we do, or we as a society have tendency of, is to apply oil on our scalp in case what is bothering us is fungal infection. Is application of oil still something that you will advise?
Infection of scalp most of the times is a with a minimum minimal minimum level, that is the pityriasis sicca, we called it as a dandruff, or in case of severe infection we called it as a seborrheic dermatitis. So it is not recommended to apply the oil because oil containing the free fatty acids which are very favorable for the growth of fungus. So if it is compulsory to apply oil, uh, apply it uh, for maximum of 1 to 2 days in a week and for the shorter period of time only.
Okay. Doctor, how can individuals with underlying health conditions such as diabetes or compromised immune systems, they best protect themselves against fungal infection through preventive measures? What do you suggest?
See, the diabetes is a immunodeficiency status. If immunodeficient conditions, basically, in the immunodeficient conditions such as people taking steroids or diabetes, these peoples are very more very prone for fungal infections. So maintaining the sugar level properly, that is the first and foremost thing people should do. That maintaining their sugars properly, taking their anti-diabetic medications properly, and people who are on long-term steroids, they should take care that maintain they should maintain their personal hygiene, because people who are taking steroids regularly, they are in the immunodeficient status. So fungus can attack that people very commonly. So this care should be taken by these people.
Okay. Doctor, are there any advancements in preventive therapies or vaccines for common fungal infections that individuals should be aware of? Any advancements?
Nowadays, no, I think there is no vaccine available for fungal infections. So
Mhm.
by just maintaining the proper hygiene or washing clothes daily, these are the preventive measures only that people should take.
Okay. Any dietary or lifestyle habits that can help boost the immune system? Because you said that immunity is very important to fight fungal infections or any other kind of infection.
See, whenever there is a lack in whenever there is a breach in the immunity, that is the
Hmm.
skin barrier, fungus takes that advantage, and by if there is any trauma or macerations, so
Hmm.
through that breach in the skin barrier, fungal enters the skin. So that is the concept. So people should people should avoid the high glycemic index foods such as oily foods or sugary products or
Hmm.
dairy products, and maintain the personal hygiene.
Okay. Now, doctor, before we sum up the whole session, any take home message, anything that you would like to share with our viewers?
See, I will say that maintain your hygiene properly, wash your
Mhm.
clothes daily, take the bath at least twice a day, and if you see any signs of fungal infection such as round patches or annular patches over the groin areas or any other body surface, consult your dermatologist instead of taking the over the counter medications.
Right. So, in case you have fungal infection, please do not self medicate. Go to the correct person, which is a qualified dermatologist, and follow the prescription, follow the doctor's advice, complete your treatment. That's very important. Uh, Before we sum up, Doctor, there are two questions by our viewers that has just come up. I'll take them quickly. One is a question by Adi Jan who is asking, Doctor, can I use neem in fungal infection? Again, a home remedy.
No, not at all. Neem act as a irritant, and if you apply that neem solutions or neem oil over the groin areas or any other buttock areas or on any other areas on which there is fungal infections, you can end up in a contact dermatitis.
Hmm.
So
Okay,
you should not apply neem or any irritant products over the fungal areas.
fair enough. Aditi Srivastav is asking, does fungal infection leaves scars?
If you treat with only topical antifungals and never not with any steroidal complications, there will not be any scars, but there will be some hyperpigmentations, that is the blackening of the skin. But if you use any steroidal combinations along with antifungals, yes, there will be some atrophic scars. There is chances of atrophic scars. So never
Okay,
use triple combinations or any other steroidal combinations in case of fungal infections. Only use purely antifungal agents.
okay. Geetika Sharma is asking, nail extensions can also cause fungal infection?
Sorry.
Nail extensions or nail art or manicure, pedicure, such procedures, can they lead to fungal infection, doctor?
If you use the sterile equipments in case of manicure pedicure, you will not end up in having fungal infections. But yes, if you use some used or unsterile equipments, there are chances of getting fungal infections.
Okay. One last
Nail
question
fungal.
that I'll. Okay, doctor. One last question is by Deepak Saxena. His question is, if I share clothes with my friends, are there chances or risk of, catching fungal infection?
Yes, of course, of course. The cloth sharing. This is the main mode of transmission of fungus. So you can get fungal infection from your friends, from your family members by sharing the clothes.
Okay. Thank you so very much, Dr. Bhushan Chaudhary. It was wonderful talking to you, sir. Thank you for making this whole session so informative for our viewers. Thank you.
Thank you.
And viewers, thank you for your participation in today's session. Stay connected to our channel. Do not forget to subscribe our channel, Radiance with You. Thank you and have a great day ahead. Goodbye.